What it do, what it do, what it do? It's your boy Big Val Opinion. And I'm here with another video, man. Another video. And I have a little this is gonna be an update from the health department. Okay. So this update say the FDA warns potential risks of false COVID test results. Wow. It reads, breaking health news. FDA warns potential risks of false COVID test results. The Food and Drug Administration, FDA, issued a release warning people to avoid using the popular at-home test kit due to inaccurate results. The FDA's actions. The FDA regularly monitors the marketing of unauthorized, unapproved, or unclear tests, including reports of problems with test performance or results. The FDA providing the information to help educate test users, caregivers, healthcare personnel, and the public, and to reduce the risk of false test results that could lead to serious illnesses and death. The FDA will keep the public informed if significant news information becomes available. False negative test results mean that the test says the person does not have COVID-19, but the person is actually infected. A false negative result may lead to delayed diagnosis of inappropriate treatment of SARS/CoV/2, which may cause people harm, including serious illness and death. False negative results can also lead to further spread of the SARS/CoV-2 virus, including when people are grouped into groups, that is, they are housed together in healthcare, long-term care, and other facilities based on these false test results. When false negative test results are received, actions to limit exposure to an infected person may not be taken, such as isolating people, limiting contact with family and friends, or limiting access to people of employment. False positive test results mean that the test says the person has COVID-19, but they are actually not infected. A false positive result may lead to a delay in both the correct diagnosis and the initial of an appropriate treatment for the actual cause of a person's illness, which could be another life-threatening disease that is not COVID-19. False positive results could also lead to further spread of the SARS/CoV-2 virus, which presumes positive people are grouped into cohorts, that is, they are housed together. Now, where is this? I'm trying to figure out what is this SARS/CoV-2 virus. I thought it was the Omicron and the HIHU or something, but this SARS/CoV-2 virus, that may be. I'm not sure. I haven't heard that. But it goes on to say false negative antibody test results mean that the test say the person does not have antibodies to the SARS-CoV-2 virus when the person actually does have antibodies. False negative results could lead to test users to take fewer precautions to prevent spread of infection if the test is used inappropriately to diagnose active infections, or if the test results is interpreted to mean that they did not have a recent infection. False positive antibody test results mean that the tests say the person does have antibodies to the SARS-CoV-2 virus when the person actually does not have antibodies to the SARS-CoV-2 virus. False positive results could lead test users to take fewer precautions to protect themselves from a future SARS-CoV-2 infection if the test result is interpreted to mean that they have had a previous SARS-CoV-2 infection. It goes on to read, reporting problem with your test. If you think you had a problem with a SARS-CoV-2 test, the FDA encourages you to report the problem through the MedWatch volunteer reporting form. If you think you had a problem with your device, the FDA encourages you to report the problem through the MedWatch volunteer reporting form. Healthcare personnel employed by facilities that are subject to FDA user facility reporting requirements should follow the reporting procedures established by their facility. If you have any questions about the safety, communication, email, and division of industry and consumer education, DICE at DICE at fda.hhs.gov or call 800-638-2041 or 301-796-7100. So you have it. The FDA is reporting that there is a big issue with a lot of false negative tests that are being reported, which means that there's a lot of people that are testing saying that they are negative, but in all reality that they are positive. But the kicker here is there's also people that are testing positive that has no effects, no symptoms, no signs. So it is something going on with these tests that they are using to generate these results. And mainly they are speaking towards the at-home test from the reading that I read. So if you're taking an at-home test and you feel as though your test is not reporting what you is not reporting according to the way that you feel, you should email the Division of Industrial and Consumer Education at DICE at fda.hhs.gov or contact them at 800-638-2041 or 301-796-7100. So there you have it. Let's make sure that if we not trusting the test results, make sure you report it to the they say you also report it to MedWatch volunteer report. Fill out a MedWatch volunteer reporting form if you're not feeling comfortable with the results that you're getting or whatever the situation may be. So bring it to a physician attention that you're not comfortable with the results that you got. If you work in a medical facility, it asks you to follow the facility procedures of as far as reporting go. So with that being said, man, that's the update right now on coronavirus, the false negative tests, It's a big issue going on right now with people that are testing positive that don't have COVID, and people that uh, have COVID are tested negative. So there you have it. So if you feel like you fall into any one of those categories, make sure you're reporting the information to the proper sources that could get you help and point you in the right direction. All right, that's been great. It's your boy Big Val Opinion, and I'm out.